currently, it is estimated that 1 in 4 Canadians may have some form of liver disease. So 1 in 4. So it's like 25% of the population has some form of liver disease. And there are like over 100 forms of liver diseases. Reasons that people may be suffering from some form of liver disease. One reason could be alcohol.
ਐਲਕੋਹਲ ਇੱਕ ਬੜਾ ਵੱਡਾ ਕਾਰਨ ਹੈਗਾ ਲਿਵਰ ਦਾ ਪ੍ਰੋਬਲਮਸ ਦਾ। ਫੈਟੀ ਲਿਵਰ ਦੇ ਬਾਰੇ ਵੀ ਇਹਨਾਂ ਨੇ ਜ਼ਿਕਰ ਕੀਤਾ ਹੈ, ਫਾਈਬਰੋਸਿਸ ਦੀ ਵੀ ਗੱਲ ਕੀਤੀ ਹੈ, ਸਾਇਰੋਸਿਸ ਦੀ ਵੀ ਗੱਲ ਕੀਤੀ ਹੈਗੀ ਹੈ।
ਸਾਇੰਟਿਫਿਕ ਰਿਸਰਚ ਕਹਿੰਦੀ ਹੈ ਕਿ a lot of these ਚੀਜ਼ਾਂ they're not curable, ਪਰ ਜਿਹੜੀ ਮੈਡੀਸਿਨ ਆਪਾਂ ਨੂੰ ਇੱਥੇ ਡਾਕਟਰਸ ਦਿੰਦੇ ਨੇ ਉਹ ਤੁਹਾਨੂੰ ਟ੍ਰੀਟਮੈਂਟ ਦੇ ਵਿੱਚ ਹੈਲਪ ਕਰਦੀਆਂ ਨੇ ਤੇ ਸੇਫਲੀ ਤੁਸੀਂ ਰੈਗੂਲੇਟ ਕਿਵੇਂ ਕਰ ਸਕਦੇ ਹੋ ਤੇ how you live with the disease or manage the disease। ਪਰ ਜਦੋਂ ਆਪਾਂ ਮੈਡੀਸਿਨਸ ਲੈਂਦੇ ਆ ਜਿਨ੍ਹਾਂ ਦਾ ਆਪਾਂ ਨੂੰ ਇੰਗਰੀਡੀਐਂਟਸ ਨਹੀਂ ਪਤਾ ਜਾਂ ਵਿੱਚ ਪਤਾ ਨਹੀਂ ਕੀ ਹੈ ਤਾਂ ਉਹ ਕਿਤੇ ਨਾ ਕਿਤੇ ਜਾ ਕੇ ਨੈਗੇਟਿਵਲੀ ਬਾਡੀ ਨੂੰ ਇੰਪੈਕਟ ਕਰਦੇ ਨੇ।
ਕਿ ਲਿਵਰ ਦੇ ਵਿੱਚ ਸੋਜਸ਼ ਹੋ ਜਾਂਦੀ ਹੈ ਜਾਂ ਕੋਈ ਪ੍ਰੋਬਲਮ ਹੁੰਦੀ ਹੈ ਤੇ ਇਹਦਾ ਕੀ ਮੁੱਖ ਕਾਰਨ ਕੀ ਸ਼ਰਾਬ ਹੀ ਹੁੰਦਾ ਹੈ? These herbal medicines many times are loaded with many chemicals and other things which can be detrimental to one's health. Okay, so let's talk a little bit about Liver Canada now. Tell us, what is the job of Liver Canada, since how long you have been operating, and what kind of awareness are you trying to create in the community? Liver ਦੀਆਂ ਵੈਸੇ ਪ੍ਰੋਬਲਮਸ ਆ ਰਹੀਆਂ ਨੇ, ਪਰ ਤੁਸੀਂ ਕੀ ਦੇਖ ਰਹੇ ਹੋ ਕਿ ਕੋਈ ਚੈਲੰਜ ਹੋ ਰਿਹਾ ਹੈ ਸਾਊਥ ਏਸ਼ੀਅਨ ਭਾਈਚਾਰੇ ਤੱਕ ਪਹੁੰਚ ਕਰਨ ਵਿੱਚ? ਕੀ ਆਪਣਾ ਭਾਈਚਾਰਾ ਇਸ ਨੂੰ ਐਕਸੈਪਟ ਕਰ ਰਿਹਾ ਜੋ ਤੁਸੀਂ ਗੱਲਾਂ ਦੱਸਦੇ ਹੋ, ਜਾਂ ਅਜੇ ਵੀ ਕੁਝ ਰੋਕ ਟੋਕ ਹੈਗੀ, ਕੁਝ ਟੈਬੂਜ਼ ਹੈਗੇ ਨੇ?
Approximately 1 in 4 Canadians have some form of fatty liver disease.
Screening is basically trying to save lives before the things happen. So we have screening for many types of diseases, as you know, for breast cancer, for colon cancer, PEP tests for cervical cancer. But for the liver disease, we don't have anything that has been really widely accepted or really population-based, sponsored by any government or any agency until now. So in the next 20 or 30 years, fatty liver will be the big one in terms of causing morbidity, cost for liver transplant, and management.
I have been concerned about the status of my health for several months now, and that is why I'm here to have my liver tested.
The Liver Beware project is a research project for FibroScan screening funded by the Canadian Liver Foundation of BC and is approved by UBC Ethics Committee.
Dr. Francis Ho was one of the founders of this project. He and Dr. Klon, with minimal contributions from myself, actually dreamed up this idea, and this was their vision. This has never been done before. Mass population screening for looking specifically at liver disease. Without proper screening, nobody will know that they have an issue and will therefore not be able to take corrective action.
I'm hoping that the results of this FibroScan test will provide some definitive problem which I can then treat with a plan to get my health back.
So if somebody actually has significant liver fibrosis or cirrhosis and don't know anything about it, until they are swollen or yellow, it's too late in terms of trying to do any intervention.
FibroScan is a non-invasive test that uses shear waves and ultrasound to quantify the severity of liver disease.
And this is an example of the result that the patient get when they come for the free FibroScan. We give them numbers of saying how much fat they have, like this blue number, and this red number is how much stiffness the liver has. We do provide the patient with this data and also explanatory note for them to go back to see their family doctor.
Our research project is important because it's characterizing the degree of fatty liver disease and fibrosis within the community. Liver disease is a problem within British Columbia and should be screened for, similar to other diseases such as cancer.
Essentially, to take this project further, which frankly needs to be done, we need resources. We need capital resources to buy more units. We need human resources. We need to be able to provide stipends and salaries to people to go out to those communities. We need those kind of things, so we need the support of donors. I'd like to thank the donors. Without the contributions of the donors, this project and many other important projects would simply not happen.
I'm looking forward to living very many more years with a smile on my face and with a fit body as what I'm used to doing.
With the number of deaths in the world, cardiovascular disease is number one, no doubt. But number of people who die from liver disease is on par of patients that die from diabetes. So it's a big number.
So I would encourage people to go get out there, go get screened for any form of liver disease that they may have in order to take preventative measures to ensure that it never gets any worse.
Early screening definitely can save lives, yes. There's no question about that.
Welcome to this episode of the Harpreet Singh Show. ਅੱਜ ਦੇ ਪ੍ਰੋਗਰਾਮ ਵਿੱਚ ਬਹੁਤ ਹੀ ਇੰਪੋਰਟੈਂਟ ਇਨਫੋਰਮੇਸ਼ਨ ਮੈਂ ਸ਼ੇਅਰ ਕਰਨ ਜਾ ਰਿਹਾ ਹਾਂ। ਲਿਵਰ ਕੈਨੇਡਾ ਤੋਂ ਮੇਰੇ ਨਾਲ ਦੋ ਮਹਿਮਾਨ ਸਾਥ ਦੇਣਗੇ ਕਿਉਂਕਿ ਲਿਵਰ ਦੀ ਬਿਮਾਰੀਆਂ ਬੜੀ ਤੇਜ਼ੀ ਨਾਲ ਕੈਨੇਡਾ ਵਿੱਚ ਫੈਲ ਰਹੀਆਂ ਨੇ। ਕਿਹਾ ਜਾ ਰਿਹਾ ਕਿ 4 ਚੋਂ 1 ਵਿਅਕਤੀ ਜਿਹੜਾ ਹੈਗਾ ਉਸ ਨੂੰ ਲਿਵਰ ਨਾਲ ਸੰਬੰਧਿਤ ਕੋਈ ਨਾ ਕੋਈ ਬਿਮਾਰੀ ਹੈ। ਸੋ ਇਸ ਸੰਬੰਧ ਵਿੱਚ ਕੀ ਕੁਝ ਹੋ ਰਿਹਾ ਹੈ ਤੇ ਕਿਸ ਤਰੀਕੇ ਨਾਲ ਅਸੀਂ ਆਪਣੇ ਆਪ ਨੂੰ ਬਚਾ ਸਕਨੇ ਆ, ਇਹਨਾਂ ਇਸ਼ੂਜ਼ ਬਾਰੇ ਗੱਲਬਾਤ ਕਰਾਂਗੇ। ਮੇਰਾ ਸਾਥ ਦੇਣਗੇ ਮੋਨਿਕਾ ਚੋਈ ਜਿਹੜੇ ਕਿ ਡਾਇਰੈਕਟਰ ਹੈਗੇ ਨੇ ਡਿਵੈਲਪਮੈਂਟ ਅਤੇ ਕਮਿਊਨਿਟੀ ਇੰਗੇਜਮੈਂਟ ਅਤੇ ਨਾਲ ਜਪ੍ਰੀਤ ਕੌਰ ਜਿਹੜੇ ਕਿ ਇੱਕ ਵੋਲੰਟੀਅਰ ਨੇ ਲਿਵਰ ਕੈਨੇਡਾ ਦੇ ਨਾਲ। ਸੋ ਦੋਨਾਂ ਹੀ ਮਹਿਮਾਨਾਂ ਦਾ ਸਵਾਗਤ ਕਰਦੇ ਹਾਂ ਤੇ ਗੱਲਬਾਤ ਦਾ ਸਿਲਸਿਲਾ ਸ਼ੁਰੂ ਕਰਦੇ ਹਾਂ। ਮੋਨਿਕਾ, ਵੈਲਕਮ ਟੂ ਦ ਪ੍ਰੋਗਰਾਮ।
Thank you for having me.
Thank you. Japreet, welcome to the program.
Hi, thank you.
Thank you. So, Monica, if you could give us some statistics as to how serious is the situation as far as liver problems are concerned in Canada?
Currently, it is estimated that 1 in 4 Canadians may have some form of liver disease. So 1 in 4. So it's like 25% of the population has some form of liver disease. And there are like over 100 forms of liver diseases, with one that is very, very common these days, and that is the fatty liver disease. So many of us would know that we have any liver compromise because for liver disease, there's no symptoms. So basically, you can have a fatty liver disease for like as long as 10, 20, 30, 40 years. You wouldn't even know about it because there are no symptoms. And then it can progress into fibrosis of the liver or cirrhosis of the liver after decades of just being hidden inside you. And by the time you see the symptoms, such as yellow skin or yellow eyes, it can be a sign of being too late. And the only option may be to have a liver transplant. And that is not even a cure. It's just help you to continue to live as normal life, so that you know hopefully it won't come back and without compromising it again.
Well, what are the reasons for all this increase in liver diseases? Because we live in a wonderful country where air is pure, everything is good. But despite that, why 1 in 4 person have some liver issues?
Reasons that people may be suffering from some form of liver disease. One reason could be alcohol. And then there are some, genetic dispositions. And then there's also something to do with our too comfortable lifestyle, like, too good of our diet and not exercise, too comfortable. So for some form of liver disease, we can adjust or cope with it by adopting a healthy lifestyle, such as eat healthily and keep moving.
Right. We will talk about what we need to do. Thank you for letting us know. I'd like to add on Japreet also over here. So Japreet, ਤੁਸੀਂ volunteer ਹੈਗੇ ਹੋ ਲਿਵਰ ਕੈਨੇਡਾ ਦੇ ਨਾਲ ਤੇ ਇਹ ਜਿਸ ਤਰ੍ਹਾਂ ਮੋਨਿਕਾ ਨੇ ਸਾਨੂੰ ਦੱਸਿਆ ਕਿ ਐਲਕੋਹਲ ਇੱਕ ਬੜਾ ਵੱਡਾ ਕਾਰਨ ਹੈਗਾ ਲਿਵਰ ਦਾ ਪ੍ਰੋਬਲਮਸ ਦਾ। ਫੈਟੀ ਲਿਵਰ ਦੇ ਬਾਰੇ ਵੀ ਇਹਨਾਂ ਨੇ ਜ਼ਿਕਰ ਕੀਤਾ ਹੈ, ਫਾਈਬਰੋਸਿਸ ਦੀ ਵੀ ਗੱਲ ਕੀਤੀ ਹੈ, ਸਾਇਰੋਸਿਸ ਦੀ ਵੀ ਗੱਲ ਕੀਤੀ ਹੈਗੀ ਹੈ। ਆਪਣੇ ਭਾਈਚਾਰੇ ਵਿੱਚ ਜ਼ਿਆਦਾਤਰ ਜਿਹੜਾ ਤੁਸੀਂ ਇਹ ਰਿਸਰਚ ਕਰਦੇ ਹੋ, ਇਸ ਸੰਸਥਾ ਨਾਲ ਜੁੜੇ ਹੋ, ਪਹਿਲੀ ਗੱਲ ਤਾਂ ਤੁਸੀਂ ਕਿਵੇਂ ਇਸ ਸੰਸਥਾ ਨਾਲ ਜੁੜੇ ਤੇ ਦੂਸਰਾ ਆਪਣੇ ਭਾਈਚਾਰੇ 'ਚ ਕੀ ਹਾਲਾਤ ਨੇ? ਕਿ ਸਾਡੇ ਵੀ ਇੰਨੇ ਹੀ ਮਾੜੇ ਹਾਲਾਤ ਨੇ ਜਿੰਨਾ ਪੂਰਾ ਕੈਨੇਡੀਅਨ ਪੋਪੂਲੇਸ਼ਨ ਦੇ ਵਿੱਚ 4 ਚੋਂ 1 ਵਿਅਕਤੀ ਨੂੰ ਲਿਵਰ ਦੀਆਂ ਪ੍ਰੋਬਲਮਸ ਨੇ?
ਹਾਂਜੀ, ਥੈਂਕ ਯੂ। ਸੋ ਮੈਂ ਰੀਸੈਂਟਲੀ ਸਟਾਰਟ ਕੀਤਾ ਲਿਵਰ ਕੈਨੇਡਾ ਨਾਲ ਵੋਲੰਟੀਅਰ ਕਰਨਾ, ਐਂਡ ਦ ਰੀਜ਼ਨ ਮੈਂ ਸਟਾਰਟ ਕੀਤਾ ਸੀਗਾ ਬਿਕਾਜ਼ ਲਾਈਕ ਮਾਈ ਪਰਸਨਲ ਜਰਨੀ ਵਿਦ ਮਾਈ ਫੈਮਿਲੀ। ਮੇਰੇ ਡੈਡ ਨੂੰ ਲਿਵਰ ਸਿਰੋਸਿਸ ਹੋਇਆ ਸੀ ਤੇ ਉਹਨਾਂ ਦਾ ਰੀਸੈਂਟਲੀ ਇਸ ਸਾਲ April ਦੇ ਵਿੱਚ ਟ੍ਰਾਂਸਪਲਾਂਟ ਹੋਇਆ। And I think ਜਿਵੇਂ ਮੋਨਿਕਾ ਨੇ ਸ਼ੇਅਰ ਕੀਤਾ I think ਆਪਣੀ ਸਾਊਥ ਏਸ਼ੀਅਨ ਕਮਿਊਨਿਟੀ ਵਿੱਚ ਵੀ ਲਿਵਰ ਸਿਰੋਸਿਸ ਜਾਂ ਫੈਟੀ ਲਿਵਰ ਦੀ ਕਾਫੀ ਜ਼ਿਆਦਾ ਪ੍ਰੋਬਲਮ ਹੈ ਜੋ ਆਪਾਂ ਸਿਰੋਸਿਸ ਕਹਿੰਦੇ ਆ ਸਿਰੋਸਿਸ ਦਾ ਮੀਨਿੰਗ ਹੁੰਦਾ ਕਿ ਤੁਸੀਂ ਉਸ ਸਟੇਜ ਤੇ ਪਹੁੰਚ ਚੁੱਕੇ ਹੋ ਲਿਵਰ ਡਿਜ਼ੀਜ਼ ਦੀ ਕਿ ਜਿਹੜੀ ਸਕਾਰਿੰਗ ਹੈ ਤੇ ਜਿਹੜੇ ਇਸ਼ੂ ਹੈ ਉਹ ਪਰਮਾਨੈਂਟ ਹੈ ਤੇ ਰਿਵਰਸੇਬਲ ਨਹੀਂ ਹੋ ਸਕਦਾ ਪਰ ਜਿਹੜਾ ਫੈਟੀ ਲਿਵਰ ਹੁੰਦਾ ਯੂਜੂਲੀ ਜੇ ਤੁਹਾਨੂੰ ਉਸ ਸਟੇਜ ਤੇ ਪਤਾ ਲੱਗ ਜੇ ਤਾਂ ਫੈਟੀ ਲਿਵਰ ਆਪਾਂ ਰਿਵਰਸੇਬਲ ਕਰ ਸਕਦੇ ਹਾਂ ਜੇ ਆਪਾਂ ਹੈਲਥੀ ਖਾਈਏ ਜਾਂ ਫਿਰ ਆਪਾਂ ਕਾਫੀ ਜ਼ਿਆਦਾ ਐਕਸਰਸਾਈਜ਼ ਕਰੀਏ ਆਈ ਥਿੰਕ ਸਾਊਥ ਏਸ਼ੀਅਨ
ਸੋ ਫੈਟੀ ਲਿਵਰ ਦੀ ਜਦੋਂ ਅਸੀਂ ਗੱਲ ਕਰ ਰਹੇ ਹਾਂ ਜਪ੍ਰੀਤ ਜੀ ਫੈਟੀ ਲਿਵਰ ਅਸਲ ਕੀ ਹੁੰਦਾ ਕੀ ਹੈ ਕਿਵੇਂ ਅਸੀਂ ਡਿਸਕ੍ਰਾਈਬ ਕਰਾਂਗੇ ਕਿ ਲਿਵਰ ਦੇ ਵਿੱਚ ਸੋਜਸ਼ ਹੋ ਜਾਂਦੀ ਹੈ ਜਾਂ ਕੋਈ ਪ੍ਰੋਬਲਮ ਹੁੰਦੀ ਹੈ ਤੇ ਇਹਦਾ ਕੀ ਮੁੱਖ ਕਾਰਨ ਕੀ ਸ਼ਰਾਬ ਹੀ ਹੁੰਦਾ ਹੈ
ਸੋ ਫੈਟੀ ਲਿਵਰ ਦਾ ਮੇਨ ਰੀਜ਼ਨ ਲਾਈਕ ਮੋਸਟਲੀ ਡਾਇਟ ਹੁੰਦਾ ਹੈ ਜੋ ਆਪਾਂ ਹੈਲਥੀ ਫੂਡ ਨਹੀਂ ਖਾਂਦੇ ਤਾਂ ਕਾਫੀ ਚੀਜ਼ਾਂ ਹੁੰਦੀਆਂ ਨੇ ਸੋ ਯੂਜੂਲੀ ਲਿਵਰ ਜਦੋਂ ਲਿਵਰ ਡਿਜ਼ੀਜ਼ ਹੁੰਦੀ ਹੈ ਤਾਂ ਲਿਵਰ ਇਨਫਲੇਮੇਸ਼ਨ ਹੋ ਜਾਂਦੀ ਹੈ ਸੋ ਜਿਵੇਂ ਤੁਸੀਂ ਕਿਹਾ ਸੋਜ ਹੋ ਜਾਂਦੀ ਹੈ ਬਟ ਆਲਸੋ ਕੀ ਕਹਿੰਦੇ ਆ ਯੂਜੂਲੀ ਜਦੋਂ ਤੁਹਾਨੂੰ ਲਿਵਰ ਡਿਜ਼ੀਜ਼ ਓਵਰ ਟਾਈਮ ਕਰੇ ਲਿਵਰ ਤੇ ਸਕਾਰਸ ਬਣਨ ਲੱਗ ਜਾਂਦੇ ਨੇ ਤੇ ਐਲਕੋਹਲ ਬਿਗ ਰੀਜ਼ਨ ਵੀ ਹੁੰਦਾ ਹੈ ਉਹਨੂੰ ਆਪਾਂ ਐਲਕੋਹਲ ਅਸਿਸਟਡ ਲਿਵਰ ਡਿਜ਼ੀਜ਼ ਕਹਿੰਦੇ ਆ ਤੇ ਫੈਟੀ ਲਿਵਰ ਯੂਜੂਲੀ ਆਪਣੀ ਡਾਇਟ ਕਰਕੇ ਹੁੰਦਾ ਐਂਡ ਨਾਟ ਇਨਫ
ਸੋ ਡਾਈਟ ਦੀ ਜਦੋਂ ਅਸੀਂ ਗੱਲ ਕਰਨੇ ਆ ਸਾਡੀ ਡਾਈਟ ਦਾ ਕੀ ਖਰਾਬੀ ਹੈਗੀ ਜਿਹਦੇ ਕਾਰਨ ਕਰਕੇ ਇਹ ਪ੍ਰੋਬਲਮ ਵੱਧ ਰਹੀ ਹੈ ਫੈਟੀ ਲਿਵਰ ਦੀ ਤੇ ਲਿਵਰ ਦੀਆਂ ਸਮੱਸਿਆਵਾਂ ਅਪਾਰਟ ਫਰੋਮ ਡਰਿੰਕਿੰਗ ਕਿਉਂਕਿ ਡਰਿੰਕਿੰਗ ਬੜਾ ਵੱਡਾ ਮੇਜਰ ਕ੍ਰਾਈਸਿਸ ਹੈਗਾ ਆਪਣੇ ਭਾਈਚਾਰੇ ਦੇ ਵਿੱਚ ਪਰ ਖਾਣ ਪੀਣ ਦੇ ਵਿੱਚ ਕੀ ਖਰਾਬੀ ਅਸੀਂ ਖਾ ਰਹੇ ਹਾਂ ਜਿਹਦੇ ਕਾਰਨ ਕਰਕੇ ਇਹ ਪ੍ਰੋਬਲਮਸ ਵੱਧ ਰਹੀਆਂ ਨੇ
I think mostly like clean food नहीं खाना आजकल आप बाहरों बहुत खाने हैं फ्राइड फूड खाने हैं sugary food बहुत खाने हैं ते when you eat all of this जो अपन नहीं enough exercise नहीं करते तो ਤੁਹਾਡੇ ਅੰਦਰ build up ਹੁੰਦਾ है second
Okay.
yes salty food खाना भी काफी ज़्यादा bad ਹੁੰਦਾ so that also adds to fatty liver because अपने food ਵਿੱਚ usually spices ਤੇ salt बहुत ज़्यादा ਹੁੰਦਾ है
Right. Okay. Monica, I would like to know from you as to like drinking is a major cause you talked about. Japreet also told us. But what about smoking and especially now vaping and drugs, which are constantly on the rise? Are they also having an impact on the liver?
Yes, they do. So, according to some emergency doctors, a lot of the times people come in at the emergency with a failing or compromised liver, and there are many reasons. And one of the reasons is because they take too many on-the-counter drugs or supplements or herbal medications. So that has to do with compromising our liver as well. So one of the key takeaways is to let people know, let the community know, don't overdo with some of the over-counter medications or some of the supplements that claim that they can detox liver. Some of you may not know that our liver carries over 500 different functions. And anything to do what we eat, what we drink, what we breathe in, what we take inside us has anything to do with liver, has something to do with our liver function, and it can detox on its own. So we don't need additional supplements to help our liver to detox. If filters anything that is inside us, it's like a big storage. So we need to keep it healthy, and it works 24/7. So
Right.
Right, so that's why alcohol is a big problem. So if we overdo with our alcohol intake, it will harm our liver. Smoking harms our lungs, predominantly, but it also affects, related to affecting our liver function. So that's why we have to be mindful about our choices, our lifestyle choices. So we always advocate for healthy lifestyle, healthy eating habit. And alcohol-related fatty liver is a big issue in some ethnic communities.
Right.
And non-alcoholic fatty liver is also affecting big time
Right.
to the global population. So basically, fatty liver is affecting about 40% of our global population, adult population, and 14% of the children population. So children, they don't drink, they don't smoke, right? And hopefully they don't overtake the over-counter medications or supplements, but it's also affecting children. So the main reason is likely related to their general diet and whether or not they have enough exercise.
Right.
in
So do you
their
have some
daily-
demographic details, Monica, in Canada about the communities that are mostly more affected by liver problems?
So there has been indications that, for example, the South Asian population has high prevalence of liver disease, um, and there have been some indications that it has both alcohol-related and non-alcoholic related fatty liver disease.
Right. Okay.
So one of the education components that we would like to raise awareness within the
Right.
South
I will
Asian
talk about that, Monica, and ask you as to how Liver Canada is trying to create awareness. But before that, Harpreet, ਜਿਹੜੀ ਗੱਲ ਕੀਤੀ ਮੋਨਿਕਾ ਨੇ, ਸ਼ਰਾਬ ਇੱਕ ਬੜਾ ਵੱਡਾ ਮੇਜਰ ਕਾਰਨ ਹੈ ਸਾਡੇ ਭਾਈਚਾਰੇ ਜਿਹਦੇ ਕਾਰਨ ਲਿਵਰ ਦੀਆਂ ਪ੍ਰੋਬਲਮਸ ਵਧ ਰਹੀਆਂ ਨੇ। ਪਰ ਉਸ ਦੇ ਨਾਲ ਨਾਲ ਹਰਬਲ ਮੈਡੀਸਿਨਸ ਦਾ ਇਹਨਾਂ ਨੇ ਜ਼ਿਕਰ ਕੀਤਾ। ਅਸੀਂ ਦੇਖਦੇ ਹਾਂ ਕਿ ਆਮ ਤੌਰ ਤੇ ਹਰ ਸਾਲ ਹੀ ਅਸੀਂ ਭਾਰਤ ਜਾਂਦੇ ਹਾਂ, ਵਾਪਸ ਜਾਂਦੇ ਹਾਂ, ਤੇ ਕਿਸੇ ਨੇ ਕੁਝ ਕਹਿ ਦਿੱਤਾ ਸਾਨੂੰ, ਅਸੀਂ ਉਹ ਦਵਾਈਆਂ ਲੈ ਲੈਣੇ ਆ ਹਕੀਮ ਕੋਲ ਜਾ ਕੇ ਜਾਂ ਆਯੁਰਵੈਦ ਦੀਆਂ, ਤੇ ਅਸੀਂ ਚੈੱਕ ਨਹੀਂ ਕਰਦੇ ਉਹਦੀ ਵੈਰਾਈਟੀ, ਤੇ ਉਹ ਵੀ ਕੀ ਹਾਰਮਫੁਲ ਹੋ ਰਹੀਆਂ ਨੇ ਸਾਡੇ ਸਰੀਰ ਵਾਸਤੇ? ਕੀ ਇਹਦੇ ਬਾਰੇ ਕੋਈ ਰਿਪੋਰਟਸ ਹੈਗੀਆਂ ਨੇ?
Yeah, absolutely. I think ਜਦੋਂ ਤੁਹਾਨੂੰ liver problems ਹੁੰਦੀਆਂ ਨੇ, ਜਾਂ even like for my dad ਜਦੋਂ ਅਸੀਂ liver specialist ਨਾਲ ਕੰਮ ਕਰਨਾ ਸ਼ੁਰੂ ਕੀਤਾ ਸੀਗਾ, so both herbal medicines and then second ਜਿਹੜੀਆਂ ਆਪਾਂ over the counter I think ਆਪਣੀ community ਜਾਂ generally ਸਾਰੇ ਹੀ ਜੋ ਆਪਾਂ ਨੂੰ ਕੋਈ ਪ੍ਰੋਬਲਮ ਹੁੰਦੀ ਆ ਆਪਾਂ ਬਹੁਤ often Advil ਲੈ ਲਈ, Tylenol ਲੈ ਲਈ, ਉਹ ਵੀ ਲੈਂਦੇ ਆ। ਉਹ ਦੋਨੋਂ ਚੀਜ਼ਾਂ ਦਾ ਨੈਗੇਟਿਵ ਇੰਪੈਕਟ ਹੁੰਦਾ ਹੈ, ਕਿਉਂਕਿ ਜਦੋਂ ਆਪਾਂ herbal medicines ਜਿਵੇਂ ਤੁਸੀਂ ਕਿਹਾ ਆਪਾਂ ਇੰਡੀਆ ਵਾਪਸ ਗਏ ਜਾਂ ਕਿਤੇ ਗਏ ਤੇ ਕਿਸੇ ਨੇ recommend ਕੀਤਾ ਕਿ not just for liver, ਆਪਾਂ ਕਹਿੰਦੇ ਆ ਵੀ ਜੀ ਕਈ ਵਾਰੀ ਮੈਂ ਬਹੁਤ ਸੁਣਿਆ ਹੈ ਕਿ ਆਪਣੀ ਕਮਿਊਨਿਟੀ 'ਚ ਡਾਇਬੀਟੀਜ਼ ਬਹੁਤ ਹੁੰਦੀ ਹੈ, ਤੇ ਤੁਸੀਂ ਇਹ ਵਾਲੀ ਹਰਬਲ ਮੈਡੀਸਨ ਲਓ ਤੇ ਉਹਦੇ ਨਾਲ ਤੁਹਾਡੀ ਡਾਇਬੀਟੀਜ਼ ਕਿਉਰ ਹੋ ਜੂਗੀ। ਸਾਇੰਟੀਫਿਕ ਰਿਸਰਚ ਕਹਿੰਦੀ ਹੈ ਕਿ a lot of these ਚੀਜ਼ਾਂ they're not curable, ਪਰ ਜਿਹੜੀ ਮੈਡੀਸਨ ਆਪਾਂ ਨੂੰ ਇੱਥੇ ਡਾਕਟਰਸ ਦਿੰਦੇ ਨੇ ਉਹ ਤੁਹਾਨੂੰ ਟ੍ਰੀਟਮੈਂਟ ਦੇ ਵਿੱਚ ਹੈਲਪ ਕਰਦੀਆਂ ਨੇ, ਤੇ ਸੇਫਲੀ ਤੁਸੀਂ ਰੈਗੂਲੇਟ ਕਿਵੇਂ ਕਰ ਸਕਦੇ ਹੋ, ਤੇ how you live with the disease or manage the disease। ਪਰ ਜਦੋਂ ਆਪਾਂ ਮੈਡੀਸਿਨਸ ਲੈਂਦੇ ਆ ਜਿਨ੍ਹਾਂ ਦਾ ਆਪਾਂ ਨੂੰ ਇੰਗਰੀਡੀਐਂਟਸ ਨਹੀਂ ਪਤਾ ਜਾਂ ਵਿੱਚ ਪਤਾ ਨਹੀਂ ਕੀ ਹੈ, ਤਾਂ ਉਹ ਕਿਤੇ ਨਾ ਕਿਤੇ ਜਾ ਕੇ ਨੈਗੇਟਿਵਲੀ ਬੋਡੀ ਨੂੰ ਇੰਪੈਕਟ ਕਰਦੇ ਨੇ।
Right. Monica, in our community, we generally see, for example, one person has taken something. You talked about detoxification. And these days with the internet age, lot of reels come where people are telling that, you do this and this will help you detoxify. Without verifying, we just adopt that. So these kind of things also are impacting and creating problems for the people?
Yes. So, I mean, there's a lot of big market out there that promote, different kinds of supplements that can help you to have a healthy liver or help to detox your liver. So right now in the medical community, there are just not enough sufficient data to support that. So what the Western medical community is saying that the liver can detox itself.
Okay.
It cleanses within us. So we don't need to rely on supplements or herbal medications to help to detox our liver. It will just make our liver work harder.
Right.
And that's why I was just mentioning earlier, like from the emergency doctors' observation, a lot of the patients who came to the emergency, some of them are affected by overloaded with these external supplemental products.
Okay. So if you have to take anything, one should consult one's doctor, and then if they say you can go ahead, then definitely. It's not that in the entire market everything is bad, but yes, these herbal medicines many times are loaded with many chemicals and other things which can be detrimental to one's health. Okay, so let's talk a little bit about Liver Canada now. Tell us, what is the job of Liver Canada? Since how long you have been operating, and what kind of awareness are you trying to create in the community?
Liver Canada is a national organization. Our head office is in Toronto, but we have regional offices. For example, I am in Vancouver, BC. So our regional office in BC is located in Vancouver. Our job is to raise awareness of liver disease and educate the public. So our mission is to reduce the incidence of liver disease through investment of research, education, advocacy, and patient support. So our vision is to have one day there will be all cures of all liver diseases, all hundreds of them, but it will require a long time and a lot of funds to do that. And we were founded in 1969, so we have a history of over 55, 56 years now. So even though our name has been changed from Canadian Liver Foundation to Liver Canada, our vision stays the same and our mission stays the same. So every
Right.
year we host many different free educational initiatives, such as the annual, very high, well-received Live Right Health forums, where we invite a number of highly regarded, excellent medical liver experts and
Right.
patients to come forward to deliver different topics related to liver disease to the general public, to patients, to families, to caretakers in different communities. And sometimes we also do it in ethnic communities where we try to find doctors who can speak the language. For
Right.
example, Chinese, Cantonese Mandarin, or even Punjabi. Or sometimes we actually get interpreters to help us.
Right. So, how are you trying to reach the South Asian community, and what has been the response of the work that has been done by Liver Canada?
In the past, we have had a few opportunities to work with the different members of the South Asian community to raise awareness about liver disease. And we have worked with some members, some leaders in the temples. And then at one point, we also worked with a few medical professionals who speak Punjabi to help us to deliver the message. And especially there is this project about the FibroScan project where we take it out to the community and scan patients with fatty liver disease and fibrosis or cirrhosis of the liver. And one time we actually brought the principal investigators of this project, Dr. Eric Yoshida and Dr. Peter Kwan, along with, at that time, a gastroenterologist who are from the South Asian community who can speak Punjabi language. We went out to a senior home where a lot of South Asian older population housed. We
Right.
deliver a talk about the FibroScan project to them, and then at the end, everybody in that senior home signed on to participate in the FibroScan project. So we would
Okay.
love to have more opportunities like that.
ਓਕੇ ਜਪ੍ਰੀਤ, ਜਿਸ ਤਰ੍ਹਾਂ ਮੋਨਿਕਾ ਨੇ ਦੱਸਿਆ ਕਿ ਲਿਵਰ ਕੈਨੇਡਾ 1969 ਤੋਂ ਕੰਮ ਕਰ ਰਿਹਾ ਹੈ, ਆਪਣੇ ਭਾਈਚਾਰੇ ਨੂੰ ਹੁਣ ਤੁਸੀਂ ਐਜ਼ ਅ ਵਲੰਟੀਅਰ ਕੰਮ ਕਰ ਰਹੇ ਹੋ, ਤੁਸੀਂ ਆਊਟਰੀਚ ਕਰ ਰਹੇ ਹੈਗੇ ਹੋ। ਤੁਸੀਂ ਪਹਿਲਾਂ ਕਿਹਾ ਕਿ ਸਾਡਾ ਖਾਣ ਪੀਣ, ਸਾਡਾ ਸਿਸਟਮ ਰਹਿਣ ਦਾ ਜਿਹੜਾ ਖਰਾਬ ਹੋ ਗਿਆ, ਉਹਦੇ ਕਾਰਨ ਇਹ ਪ੍ਰੋਬਲਮਸ ਪੈ ਰਹੀਆਂ ਨੇ। ਸੋ ਕੀ ਕੀਤਾ ਕੀ ਜਾਵੇ, ਕਿਸ ਤਰ੍ਹਾਂ ਆਪਣੇ ਲਿਵਰ ਨੂੰ ਮਜ਼ਬੂਤ ਰੱਖਿਆ ਜਾਵੇ ਕਿ ਜਿਹੜੇ ਖਾਸ ਤੌਰ 'ਤੇ ਸਾਡੇ ਮੱਧ ਵਰਗ ਦੇ ਲੋਕ ਹੈਗੇ ਨੇ, ਹੁਣ ਤਾਂ ਬੱਚਿਆਂ 'ਚ ਵੀ ਲਿਵਰ ਦੀਆਂ ਵੈਸੇ ਪ੍ਰੋਬਲਮਸ ਆ ਰਹੀਆਂ ਨੇ, ਪਰ ਤੁਸੀਂ ਕੀ ਦੇਖ ਰਹੇ ਹੋ ਕਿ ਕੋਈ ਚੈਲੰਜ ਹੋ ਰਿਹਾ ਹੈ ਸਾਊਥ ਏਸ਼ੀਅਨ ਭਾਈਚਾਰੇ ਤੱਕ ਪਹੁੰਚ ਕਰਨ ਵਿੱਚ, ਕਿ ਆਪਣਾ ਭਾਈਚਾਰਾ ਇਸ ਨੂੰ ਐਕਸੈਪਟ ਕਰ ਰਿਹਾ ਜੋ ਤੁਸੀਂ ਗੱਲਾਂ ਦੱਸਦੇ ਹੋ, ਜਾਂ ਅਜੇ ਵੀ ਕੁਝ ਰੋਕ ਟੋਕ ਹੈਗੀ, ਕੁਝ ਟੈਬੂਜ਼ ਹੈਗੇ ਨੇ?
I think because ਮੈਂ volunteer ਬਹੁਤ recently start ਕੀਤਾ, right? ਤੇ one of the reasons that ਮੈਂ volunteer ਕਰਨਾ ਚਾਹੁੰਦੀ ਸੀ Liver Canada ਨਾਲ is because ਜਦੋਂ ਮੈਂ ਮੋਨਿਕਾ ਨਾਲ connect ਕੀਤਾ ਤਾਂ I learned ਕਿ ਆਪਣੀ community ਦੇ ਵਿੱਚ ਉਹਨਾਂ ਨੇ ਕਾਫੀ outreach ਕਰਨ ਦੀ ਕੋਸ਼ਿਸ਼ ਕੀਤੀ ਹੈ, ਪਰ ਮੈਸੇਜ ਤੇ awareness ਇੰਨਾ ਜ਼ਿਆਦਾ ਲੋਕੀ seriously ਨਹੀਂ ਲੈਂਦੇ, ਜਾਂ ਫਿਰ a lot of people, especially the FibroScan ਦੀ ਗੱਲ ਹੋਈ, I think they are trying do a scan from the last 3 or I think 4 years. They apni community ਦੇ ਵਿੱਚ ਸਭ ਤੋਂ ਜ਼ਿਆਦਾ acceptance rate ਹੈ, a lot of people participate ਨਹੀਂ ਕਰਦੇ ਹੈਗੇ। ਤੇ I think it's because enough advocates ਨਹੀਂ ਹੈਗੇ, ਤੇ ਦੂਜੀ ਗੱਲ enough awareness ਨਹੀਂ ਹੈਗੀ। ਤੇ ਜਿਵੇਂ ਤੁਸੀਂ ਕਿਹਾ, like so diet is a big thing, ਬੱਚਿਆਂ ਦੇ ਵਿੱਚ ਵੀ ਬਹੁਤ ਪ੍ਰੋਬਲਮ ਹੈ। I think biggest ਚੀਜ਼ਾਂ ਜਿਹੜੀਆਂ ਆਪਾਂ ਕਰ ਸਕਦੇ ਹਾਂ is first like healthy eating, right? ਤੁਸੀਂ ਖਾਓ, ਆਪਣਾ ਬਾਹਰੋਂ ਖਾਣਾ ਘਟਾਓ, ਜਾਂ ਫਿਰ like keep everything moderation ਦੇ ਵਿੱਚ good ਹੁੰਦਾ, right? But ਅੱਜ ਕੱਲ੍ਹ ਆਪਾਂ like let's say frozen food, ਜਾਂ ਫਿਰ almost everyday ਬਾਹਰੋਂ ਖਾਣਾ, ਕਾਫੀ sugary ਖਾਣਾ, processed food ਬਹੁਤ ਜ਼ਿਆਦਾ ਖਾਂਦੇ ਆ, processed food ਦੇ ਨਾਲ ਵੀ impact ਹੁੰਦਾ ਹੈ। ਤੇ ਕੀ ਕਹਿੰਦੇ ਆ, exercise ਬਹੁਤ ਵੱਡੀ ਚੀਜ਼ ਹੈ। I think ਕਈ ਵਾਰੀ ਆਪਣੀ community ਦੇ ਵਿੱਚ especially ਜਦੋਂ elders ਦੇ ਵਿੱਚ ਵੀ, whether ਤੁਸੀਂ ਰੋਜ਼ ਸੈਰ ਕਰੋ, right? Like that's also important, and ਉਹ ਵੀ ਇੱਕ exercise ਦਾ form ਹੈ। So ਆਪਾਂ ਨੂੰ ਕੁਛ ਨਾ ਕੁਛ ਆਪਣੀ ਹੈਲਥ ਲਈ ਤੇ ਐਕਸਰਸਾਈਜ਼ ਲਈ ਐਵਰੀਡੇ ਕਰਨਾ ਚਾਹੀਦਾ ਹੈ। ਐਂਡ ਸੈਕੰਡ ਆਫ ਆਲ ਆਈ ਥਿੰਕ ਜਿਹੜੇ ਆਪਣੇ ਈਟਿੰਗ ਹੈਬਿਟਸ ਆਪਣੀ ਕਮਿਊਨਿਟੀ ਵਿੱਚ, ਆਈ ਥਿੰਕ ਜਿਵੇਂ ਫॉर ਐਗਜ਼ਾਮਪਲ ਲਾਈਕ ਡਿਨਰ ਬਹੁਤ ਲੇਟ ਖਾਂਦੇ ਆਪਾਂ, ਰਾਈਟ? ਸੋ sometimes मैं देखिए आप dinner बहुत late
ਤਲਿਆ ਬਹੁਤ ਖਾਂਦੇ ਹਾਂ, ਡਿਨਰ ਬਹੁਤ ਖਾਂਦੇ ਹਾਂ, ਬਾਹਰੋਂ ਖਾਂਦੇ ਹਾਂ। ਉਸ ਤੋਂ ਇਲਾਵਾ ਸਾਡਾ ਖਾਣ ਪੀਣ ਦੇ ਵਿੱਚ ਲੇਟ ਜਿਹੜਾ ਹੈ, ਜਿਸ ਤਰ੍ਹਾਂ ਤੁਸੀਂ ਕਿਹਾ ਕਿ ਆਮ ਤੌਰ 'ਤੇ ਸਾਡਾ ਡਿਨਰ 10-11 ਵਜੇ ਹੀ ਹੁੰਦਾ ਹੈ ਬਹੁਤ ਸਾਰੇ ਘਰਾਂ ਦੇ ਵਿੱਚ। ਸੋ ਇਹ ਚੀਜ਼ਾਂ ਦਾ ਪ੍ਰਭਾਵ ਜਿਹੜਾ ਉਹ ਲਿਵਰ 'ਤੇ ਇੰਪੈਕਟ ਪਾਉਂਦਾ ਹੈ।
yeah because liver ਇੱਕ ਕੋਈ organ ਆਪਣੇ body ਦੇ ਵਿੱਚ, ਜਿਵੇਂ ਮੋਨਿਕਾ ਨੇ ਵੀ ਕਿਹਾ ਰਾਈਟ, ਉਹ ਆਪਣੇ ਆਪ ਨੂੰ ਵੀ ਡੀਟੌਕਸ ਕਰ ਸਕਦਾ ਹੈ, ਪਰ ਉਹ liver is also responsible ਕਿ ਜਿਹੜੇ ਤੁਹਾਡੇ body ਦੇ ਵਿੱਚ, ਆਪਣੇ ਸਾਰਿਆਂ ਦੇ normally body ਦੇ ਵਿੱਚ ਟੌਕਸਿਕ ਤੇ ਵੇਸਟ ਪ੍ਰੋਡਕਟਸ ਹੁੰਦੇ ਨੇ ਜੋ ਲਾਈਕ ਆਪਣੇ ਆਪ ਹੀ ਲਿਵਰ ਉਹਨਾਂ ਨੂੰ ਡੀਟੌਕਸ ਕਰਦਾ ਹੈ ਤੇ ਬੋਡੀ ਦੇ ਵਿੱਚੋਂ ਕੱਢਦਾ ਹੈ। ਪਰ ਜਦੋਂ ਲਿਵਰ ਪ੍ਰੋਪਰ ਨਹੀਂ ਕੰਮ ਕਰ ਰਿਹਾ ਤਾਂ ਟੌਕਸਿਕ ਤੇ ਵੇਸਟ ਪ੍ਰੋਡਕਟਸ ਤੁਹਾਡੇ ਬੋਡੀ ਦੇ ਵਿੱਚ ਅਕਿਊਮੂਲੇਟ ਵੀ ਹੁੰਦੇ ਨੇ, ਰਾਈਟ? ਸੋ
Thank you. So, Monica, towards the end, if you can let us know that you are trying to outreach to the community, and you said, initially that symptoms are not visible initially, but later on it can create problems. So, are there some tests or anything else that the public can, apart from what you and Harpreet told us, that eat healthy, don't burden your liver with unnecessary things? So, what kind of tests are available, and how can the community reach Liver Canada?
Right. So, one of the projects that we are doing, thanks to individual donors that make it possible for us, is the FibroScan screening project. So, thanks to a donor, we were able to purchase a FibroScan machine where we take out to the community and screen people, whether they have fatty liver disease, fibrosis of the liver, or cirrhosis of the liver. So, this is part of our advocacy for early screening, because early screening will lead to early detection. And once you find out whether you have the disease, then you will have a treatment plan, to manage it, to cope with it, right? So, so this project we started about 4 years ago, 2022, and this year is 2025, for 4 years now. So I can give you some numbers in perspective. Sure. Within the past 4 years, we have screened over 7,560 patients, voluntary patients. And the breakdown is the highest population who came forward to get screened is the Chinese population. There are about 3,000 of the Chinese people who came out to do the screening, followed by the general Canadian Caucasian population, about 2,700. So for the South Asian community, the number is roughly around 1,500. Okay. So every year we try to do the best that we can to outreach to the South Asian population.
Well, Monica, don't worry. The South Asians are going to outbeat the Chinese now with the programs that we are having and trying to reach the community. So where can you be reached?
So they can reach out to Liver Canada, the Vancouver office. If they are interested in getting a scan done, they can either email us at liverbeware@liver.ca, the project name liverbeware@liver.ca, to tell us their name and phone number so that we can immediately put them on 2026 list. Because right now, I have over 600 people on the wait list for 2026. So I would definitely want to invite the South Asian members to come forward to be added onto the list. And then they can also give me a call in the office, 604-707-6433. Leave their name and phone number and their email address. Then I will definitely add them onto the list before we start promoting them. Yeah.
Okay, wonderful. So the best thing to go for is a scan so that one can understand where their liver is, what kind of issue are they facing, and that scan will let them know. Monica and Harpreet, thank you very much for your time. It was a pleasure talking to both of you. Keep on doing the good work, and not hopefully, but definitely the community will come forward and take advantage of the services being given by Liver Canada. Thank you.
Thank you so much.
Thank you for having us.
Thank you. ਸੋ ਇਹ ਸਨ ਜੀ ਮੋਨਿਕਾ ਚੋਈ ਅਤੇ Harpreet ਲਿਵਰ ਕੈਨੇਡਾ ਤੋਂ, ਜਿਨ੍ਹਾਂ ਨੇ ਸਾਨੂੰ ਦੱਸਿਆ ਕਿ ਲਿਵਰ ਦੀਆਂ ਬਿਮਾਰੀਆਂ ਦੇ ਵਧਣ ਦੇ ਕਾਰਨ ਕੀ ਹੈਗੇ ਨੇ ਤੇ ਇਸ ਵਾਸਤੇ ਕੀ ਕੀਤਾ ਜਾ ਸਕਦਾ ਹੈ। ਹੁਣ ਇਸ ਕਰਕੇ ਖਾਸ ਤੌਰ ਤੇ ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਵਿੱਚ ਜਿਹੜੇ ਲੋਕ ਰਹਿੰਦੇ ਨੇ ਉਹਨਾਂ ਨੂੰ ਬੇਨਤੀ ਹੈ ਕਿ ਵੱਧ ਚੜ੍ਹ ਕੇ ਤੁਸੀਂ 604-707-6433 604-707-6433 ਤੇ ਫੋਨ ਕਰੋ, ਆਪਣਾ ਨਾਂ ਰਜਿਸਟਰ ਕਰ ਲਓ ਤਾਂ ਕਿ 2026 ਦੇ ਵਿੱਚ ਜਦੋਂ ਇਹ ਸਟਾਰਟ ਕਰਦੇ ਨੇ ਸਕੈਨਸ ਤਾਂ ਤੁਹਾਨੂੰ ਇਹ ਫੋਨ ਕਾਲ ਕਰਕੇ ਬੁਲਾਉਣ ਤੇ ਤੁਸੀਂ ਆਪਣੇ ਲਿਵਰ ਦੀ ਕੰਡੀਸ਼ਨ ਦਾ ਜਾਇਜ਼ਾ ਜਿਹੜਾ ਇਹਨਾਂ ਸਕੈਨਸ ਤੋਂ ਲੈ ਸਕੋ, ਜਾਂ ਫਿਰ ਈਮੇਲ ਕਰੋ liverbeaware@liver.ca। ਇੱਥੇ ਤੁਸੀਂ ਈਮੇਲ ਵੀ ਕਰ ਸਕਦੇ ਹੋ। ਆਪਣਾ ਸਿਹਤ ਨੂੰ ਆਪਣੇ ਹੱਥ ਵਿੱਚ ਲੈ ਕੇ ਕਾਮਯਾਬ ਹੋਣਾ ਬਹੁਤ ਜ਼ਰੂਰੀ ਹੈ, ਕਿਉਂਕਿ ਸਾਨੂੰ ਪਤਾ ਹੈ ਕਿ ਸਾਡੇ ਮੈਡੀਕਲ ਫੈਸਿਲਿਟੀਜ਼ ਦੀ ਕੀ ਕੰਡੀਸ਼ਨਸ ਨੇ। ਸੋ ਜੇਕਰ ਅਸੀਂ ਆਪਣੇ ਆਪ ਨੂੰ ਪਹਿਲਾਂ ਹੀ ਸਤਰਕ ਕਰਕੇ ਬਿਹਤਰ ਆਪਣੀ ਸਿਹਤ ਨੂੰ ਰੱਖ ਸਕੀਏ ਤਾਂ ਫਿਰ ਸਾਨੂੰ ਲੋੜ ਨਹੀਂ ਪਏਗੀ ਅਨਨੈਸੈਸਰੀ ਹਸਪਤਾਲਾਂ ਵਿੱਚ ਜਾ ਕੇ ਧੱਕੇ ਖਾਣ ਲਈ। ਸੋ ਇਸ ਕਰਕੇ ਆਓ ਸਾਰੇ ਯਤਨ ਕਰੀਏ ਕਿ ਆਪਣੇ ਆਪ ਦੀ ਸਿਹਤ ਨੂੰ ਆਪਣੇ ਹੱਥਾਂ ਵਿੱਚ ਹੀ ਲੈ ਕੇ ਸੰਭਾਲ ਕੇ ਅੱਗੇ ਕਾਮਯਾਬ ਹੋਈਏ। ਪ੍ਰੋਗਰਾਮ ਦੀ ਕਰਦੇ ਇੱਥੇ ਹੀ ਸਮਾਪਤੀ। ਮੇਰੇ ਨਾਲ ਸੰਪਰਕ ਕਰਨਾ ਹੋਏ ਤਾਂ 6046037555 ਤੇ ਤੁਸੀਂ WhatsApp ਰਾਹੀਂ ਸੰਪਰਕ ਕਰ ਸਕਦੇ ਹੋ ਜਾਂ ਫਿਰ ਈਮੇਲ ਕਰੋ harpreetsingh@gmail.com। And thank you very much for sparing your valuable time and being a part of this program. If you have any issue which you think needs to be discussed, please do contact so that we can come forward with those programs. ਇੱਥੇ ਹੀ ਪ੍ਰੋਗਰਾਮ ਦੀ ਸਮਾਪਤੀ ਹੈ, ਫਿਰ ਮੁਲਾਕਾਤ ਕਰਾਂਗੇ। Have a wonderful day.
Because you have taken part the Canadian Liver Foundation BC Yukon's Liver Beware FibroScan Screening Project, a project that was started by our late beloved Dr. Francis Ho, our past chapter board president, by Mr. and Mrs. Sunny and Florence Leung for their continued commitment to liver research and education. We were able to purchase a FibroScan machine and bring this project to the community to benefit you. The purpose of this video is to explain why it is important to get tested for liver fibrosis or fatty liver disease, help you understand your FibroScan result and what you can do about it. So please join me in welcoming our project leader, Dr. Peter Kwan, and family physician, Dr. Thomas Ho.
Hi, I'm Dr. Thomas Ho, a family physician. So fatty liver, like the chronic disease in family practice, in the early stage, like hypertension, diabetes, dyslipidemia, they usually have not much symptoms, and the patient does not even know about it. Now, most of the time we discover it when we do a blood test, an annual blood test, liver function test, or do an ultrasound of the abdomen, and then they report there's some increased echogenicity and implies fatty infiltration of the liver. And a lot of times the patient asks, oh, how bad is my liver? And give me a number or something. We cannot give it to them. But I think this FibroScan is a good thing. It's very non-invasive and give us a little bit of a quantitative measure how bad the liver is and how fatty and how fibrosis the liver. So about Dr. Peter Kwan, can you enlighten me on that and about your project?
Okay, thank you, Dr. Ho. The project is very simple because of all the major causes of chronic liver diseases, there's two that stands out that are difficult, and one is alcohol. Alcoholic hepatitis and cirrhosis, but that is really not something we can tackle on an individual basis, like just one doctor or one person. But fatty liver is probably the remaining major cause of liver disease that we can do something about, and also the other ones are hepatitis B and C, and they have medication that can control or even cure them. And fatty liver, the medications are coming, but it's a big proportion of population will have that. Estimated in Canada, at least probably 20 to 30% or more. In some parts of the US, even more than that, have fatty liver. So therefore, with the support of a very generous donor and also other donors, I try to set up a project to see what is the prevalence of fatty liver in the lower mainland, and really how many people who are asymptomatic actually has significant chronic liver diseases that may be overlooked. And on top of that, just last remark is that I think you, Dr. Ho, is a family doctor for many years, and you follow your patients well, and you check them once a year, every couple of years. But right now, there's a lot of patients that don't have any family doctors. And so therefore, they are not getting, even the routine blood tests they're used to get in the old days. So I think that there will be a lot of people that will fall between the cracks. That's why we started this project.
Thank you. Now, as I said, every disease, we try to detect it early, treat it early, and prevent it. Now, for fatty liver, I understand initially started with some fatty changes in the liver. Later, it can go to inflammation of the liver. Recurrent inflammation can cause scarring and fibrosis of the liver, and later on cause cirrhosis and even lead to liver failure. And also it might be related to liver cancer too. Now, Dr. Kwan, a few questions. One is, what's the time frame for this to happen? And secondly, since it is important to detect it early and treat it early, what stage is it reversible and when is it becomes irreversible, that is the permanent damage? And lastly, there are two abbreviations which is commonly used, the NAFLD and the NASH. Can you comment on those?
Wow, that's a loaded question, Dr. Ho. Okay, I think I'll start answer the last one first. The NAFLD is a generic term. Non-alcoholic fatty liver disease is like saying that there are cars. And NASH is more specific, saying that is non-alcoholic steatohepatitis. This is when the fatty liver actually causes inflammation in the liver. It's like it's a brand of a car. It's a Honda. It's a Toyota. So the thing is that the one thing people have to know is that they should not get really too excited or really worry if the ultrasound said they got fatty liver, because not all fatty liver will lead to inflammation. The mechanism is still unknown. People have tried all kinds of research, but what triggers the fatty changes, causes inflammation, is there still a bit of mystery around that. But one thing we know for sure is that when people with fatty liver has diabetes, these are the ones that are more prone to getting the problem than just fatty liver itself without diabetes. So I think that patients should not get really too upset when they get ultrasound reports saying got too much fat. Usually in the old days, you would say that NASH or NASH occurs only if the patient has abnormal liver enzymes. And of course, there's some truth to that, but the thing is that this is not universal. Sometimes, we've seen patients who have fatty liver with inflammation to the point of cirrhosis. The liver enzymes actually are fairly normal and you can escape detection. So in terms of when the time frame is that there are lots of time to catch it. I think that for somebody who has fatty liver that actually has inflammation associated, it will still take them 20, 30 years before they get into serious trouble. So there's a lot of time, a lot of time you can catch. And I think that in terms of how reversible it is, usually the liver respond to inflammation or injury from any kind, go through fibrosis. So the FibroScan actually gives you a score that would be equivalent to or translate to the stages of fibrosis. The first stage, second, 3, and 4. 4 being the worst is the cirrhosis. So usually when people get some sort of insult to the liver that causes fibrosis, up to about 2 or 3, if you remove the insult, then quite often it will reverse to a degree. However, when you get to be the cirrhotic or last stage, even if you remove the insult, doesn't matter if it's alcohol or hepatitis C or something, the liver may not go backwards anymore towards normal. Okay, does that answer the question?
Who are the persons who are at risk for this fatty liver?
Okay, I think I should, population-wise, okay, I usually tell them there are 6 sort of major factors. One we cannot control is genetics. There are some genes that are associated with development of fatty liver that is inherited. And so genetics is one. And number 2 is that the patient herself himself is overweight. It's too fat. Number 3 is high cholesterol. Number 4, as mentioned before, which is a big factor in terms of predicting inflammation, is diabetes. Number 5 is alcohol. I'm missing one thing. You're too fat. Okay, eat too much fat. Okay, 6th thing. You like to eat fat, you're overweight, you got diabetes, and maybe there's a family history, then you have a significant risk of getting fatty liver with inflammation.
Okay, now let's get to the basic. Now, everyone got the FibroScan and they were given a piece of paper like this, and with all the numbers, and they got all excited. There's the blue number and the brown number, and then they said, oh, what is my examination result? Now I understand the CAP score in decibels per meter measures how much fat you have in the liver, and the blue number, and the fibrosis score, the E score in kPa measures how stiffness, how much scarring, how much fibrosis you have in the liver. and there are quite other numbers, IQR, and IQ. And so, Dr. Peter Kwan, maybe you can comment on it. When should I get worried, and what are the numbers which are good, and what are the numbers which are bad? Can you elaborate on it?
Okay, well, we go with your order you described. The CAP score is basically an estimation how much fat in the liver, and it is in a decibel per meter, which is sound measurement in a way. The normal should be less than 200 to 220. So if your CAP score is anywhere around 300, then you should start to get, you got pretty well moderate fatty liver. So the maximum it can measure is up to 400. So if your CAP score is like 399, that means that your liver is really has significant amount of fat in it. So I think that is there are a lot of things on the internet you can look at. They will divide this up like 230 to 260 and 260 to 310 or something. But I think that on the ballpark, I think that if your CAP score is nearing 300, then you should pay attention for sure. Okay, now the other score, the kPa, a kilopascal, actually is more of an important number because it actually measures how much the liver has scarring and fibrosis. So unfortunately, when the verification data were done, they were done with biopsies, observation, and measurement, and they basically, the kPa or the elasticity of the liver actually depends on a little bit on the diagnosis. But for fatty liver or most liver disease concern, if the kPa is less than 5 or 6, you can say that you probably don't have any fibrosis at all. If your score is in the range of 12, 13, or 14, then you probably has the cirrhosis already. So the other are somewhere in between. Let's say if somebody comes in, if their CAP score is 390, but the elasticity of the liver is like 5, then the patient don't have to worry so much. In contrast to somebody who comes in, they may not have any fat, the CAP score may be 200, but the elasticity of the liver is like 14 or 15, then this patient probably has to get work up and see what happens.
Yeah. So now, for example, in this sample, this guy's CAP is 195 and the fibrosis score is 4.2. So he's pretty good, right, in terms of his fatty change and his fibrosis and his scarring. He's kind of within quite normal limits.
That's right.
And in other words, I'd rather have a higher CAP score than a high fibrosis E score, which is we have to be more concerned about the E score. Okay. Now after, for example, if I have a higher CAP score now, we know the results. So what are we going to do? We know that we don't have any readily available medications like hypertension, like statin and diabetic medications. And mainly is the lifestyle, diet, losing weight, exercise, and low carb diet. Dr. Kwan, can you comment on these? What should the patient do now?
Everything. So I think the most important to understand that, for example, somebody with a high CAP score and also has some degree of fibrosis, let's say around 9 or 10, where you should tell them to exercise, low carbohydrate diet, weight loss, etc. But bear in mind, the patient does not have to lose like a huge amount of weight to see benefit. For example, I got a lady who is like 180 pounds of, the high, CAP score 300 something, and and the fibrosis is around 10. All she did was lost about 20 pounds, and it made a big difference already in the numbers. So patients don't have to go back to when they're like 18 years old, that kind of weight. That's number one. So they don't have to be so discouraged. All you have to do is more exercise and lose some weight. You don't have to lose a huge amount. And the second thing I want to talk about, which is somebody asked, and maybe I didn't answer it accurately last time, is the IQR. They always wonder what the hell, is this IQR, sitting there. The IQR basically is an internal number to see how accurate our measurements are. Basically, when they actually do the FibroScan, they don't do it just one time. They do it 10 times or so. they can see that's why there are 10 diagrams on the piece of paper. The IQR basically try to measure if these numbers correlate within a tight dispersion range. If it does, then the numbers are, the values that we give, they are like accurate. If the IQR is too high, there's too much dispersion, that means that the measurement may not be that accurate. So anything less than, they say there's an IQR 0.4, there's a something median, give you a percentage. If the IQR, basically in terms of the percentage, is easier to remember, less than 15, this means the numbers are okay. Something like that.
Okay, thank you. So in summary, we have some numbers to attach. You know how healthy our liver is. There's a long time frame that we can work on our lifestyle, our diet, weight reduction, and to keep ourselves healthy. It's like all the other chronic disease like diabetes, dyslipidemia, hypertension. There's something which we catch early, we can prevent irreversible damage to our liver. So it is very good. Now, any clinical trials going on, any new developments in medications in the near future, Dr. Kwan?
Well, I think that all the major drug company knows that after the Hep B and hepatitis B and C medications, the next holy grail in terms of liver medication is fatty liver. If they can develop a drug that that is a very effective, low side effect and reverse the inflammatory change in fatty liver, they basically hit the jackpot. So there are many drug companies that are doing that. And there's some trials that are very reasonably promising. So I think that in the near future, you will see that in the next, I would say less than 5 years, you will see some medications on the market for fatty liver for sure. But the thing is that it's just like drugs. It's drugs. It's like high blood pressure or hyperlipidemia or diabetes. You still need your lifestyle changes. You cannot say that I'm just going to take a pill and eat all the barbecue duck I want. But that's not the way it goes. So I think that people have to realize that they have to look after themselves. I think that you probably agree with that. They can't still rely on pills for everything.
Well, certainly, that's the role of family practice. We have to keep selling what's healthy to them, and it's sometimes not easy to do. But in the meantime, we'll work hard and get everyone healthy. Thank you, Dr. Kwan.
Thank you, Dr. Ho.